Hello dear students and my dear nursing aspirants. So today in this video I am going to discuss a topic which is not only important for the competitive exams as well as it is important for every nursing professional. Okay, so even though maybe they are the student or maybe they are the nursing officers or maybe they are as a teaching faculty. Okay, so during their practice, so this what topic I am taking, so this is very important for them. Okay, so every nursing professional should know this topic. So that is why it is a very important topic, not only for a personal professional growth as well as for the exam point of view. So I think with the thumbnails you might be understood what topic I am taking today. Okay, it is nothing, it is none other than the ethical principles. Okay, so means what ethics we should maintain during our nursing practice, and how it is important for the point of competitive exams, that we will discuss it in the today's video. So if anybody is watching my channel for the first time, please do subscribe and press the like and the bell icon so that you will never miss a video notification. So without making a much delay, so then let's get into the topic. So ethical principles. So before we go for them, what are actually the ethical principles? Let's understand what mean by ethics. See, ethics are nothing but, so these are some principles. It will determine or it will help the nurse in deciding what is right and what is wrong in providing the patient care. Okay, so in general, we can say that these ethics are the principles that guides the nurse in determining what is right and what is wrong in relation to the patient care. Okay, with the professional integrity. Okay, with maintaining the professional integrity. Integrity stands for the morality. Okay, then means we should have some morals. Okay, like what is right and what is wrong we should know. Okay, integrity always stands for the adhering to the honesty. Okay, being honesty in providing the care. Okay, or to the profession. So that is all we call it as a professional integrity. So with this a professional integrity, uh, these ethics will help a nurse whether she is doing right or whether she is doing wrong in providing the patient care. So those are called as a ethics. Okay, in simple words, you can remember it as like what is right and what is wrong in providing the patient care, that will be determined by these ethical principles. Okay, these will help ये जो ethics है और ethical principles है nurses को जो पेशेंट केयर में कुछ सही काम कर रहा है या गलत काम कर रहा है वो डिटरमाइन करने के लिए या आइडेंटिफिकेशन करने के लिए नर्सेस को हेल्प करेगा विद द प्रोफेशनल इंटीग्रिटी. तो इसको जो हम बोलते हैं एथिक्स. तो द नेक्स्ट आता है कोड ऑफ एथिक्स. कोड ऑफ एथिक्स. द कोड ऑफ एथिक्स, these are the formal set of principles or the guidelines that directs the nurses professional conduct, ensuring they provide a safe, compassionate and the ethical care while respecting the patient's rights and the dignity. See here, the code of ethics means, so these are the guidelines, okay, or the set of guidelines or the set of what we can say, these are a set of instructions. Okay, that will direct or that will decides the nurse's professional conduct. So that decides the nurse's professional conduct. See what actually meant by this professional conduct. The professional conduct is nothing but it refers to an behavior of a nurse or an attitude of a nurse or the standards that we expect from a nurse in the profession. Okay, so how the nurse should behave or what are the standards she should maintain in the profession. So that is all what we call it as a professional conduct. See, these instructions or the guidelines will decides the or it will decides the professional conduct of a nurse, so that she can provide a safe care with the compassionate means with the like empathy and the sympathetic approach, and by maintaining the ethics in and also in respecting the patient's rights and the dignity. Okay, by respecting the patient, as well as we should always give respect to her the patient's right. So those set of guidelines or those set of instructions were called as a code of ethics. So means, so these are the principles which decides the professional conduct of a nurse. So in simple words, what we can say, so these set of guidelines describes the professional conduct of nurse. So as I told, the professional conduct means what's her behavior, what standards she should maintain, what's her attitude should be there in a profession. So all these together we can call it as a professional conduct. So this professional conduct will be described by this a set of principles. They are called as a code of ethics. These code of ethics were first time adopted by the ICN. Okay, that is International Council of Nurses. Okay, that is ICN in the year of 1953. So recently in the year of 2021, so these code of ethics were revised, and these code of ethics were being followed globally. Means many countries they follow the instructions or the guidelines which are given by the ICN, that is code of, that is International Council of Nurses. And we, that is in India, we follow the set of guidelines or the code of ethics were given by the INC, that is Indian Nursing Council. So these were adopted in the year of 2006. So this is very important. You must remember this, what ethical code of ethics we are following. Means in India, so in India we follow the code of ethics given by Indian Nursing Council, but globally, so we follow the code of ethics given by ICN, that is International Council of Nurses. So these are the these questions may come in your competitive exams. So not much important, might come in your exams. So now let us discuss what are the ethical principles that we have to uh, maintain, or we have to follow in providing a safe and the compassionate care to the patients. So principles, so actually there are basically there are four principles. So these four are considered to be the basic ethics or the basic ethical principles. Okay, so there are other than this four, there were nearly about 8 to 10 ethical principles are there. So these are very important. You may get a question on these ethical principles in the competitive exams. If the first ethical principle is the autonomy. The autonomy means, auto stands for the self. Okay, so means here it is nothing but a freedom of choice. Okay, or freedom of making choice, or accepting the responsibility of one's choice. Means the patient has a right to make their own decision. So that is all what we call it as a autonomy. We should always respect the patient's choice. The choice uh, may be right or wrong to you, but we should always accept the patient's choice. So say for an example, the patient needs a surgery. Okay, so you explain everything to the patient. Okay, like what are the complications might occur if you don't go undergo the surgery, or what are the benefits are there if you undergo the surgery. Even after explaining everything, okay, the patient refuses for the undergoing the surgery, he denies for a surgery. So there the patient choice is not to undergo the surgery, but it is against the doctor's choice. So here we have to respect the patient's choice. That is what the patient has a right to make his own choices. Okay, that is a freedom of choice we call. So that is to be respected. So that principle we call it as a autonomy. So this is very very important. The many times in the exams you got a question on this autonomy. So here we can take an example like patient refusing the surgery after the information given related to the risk and the benefits. And even you can take an example like uh, patient refuses for the treatment. Okay, so you explain related to the adverse effects and the benefits of a drug, but still the patient doesn't want to take a medication. So that is all, that is what is decision. So there we have to respect the a patient's a choice of a decision. Then the second very basic principle is the beneficiency. Okay, this is also very important. So beneficiency, where the word beneficiency stands for the benefit. The benefit means whatever the work or whatever the things we do for the patient, it should be in the benefit of patient. Okay, so always it does a benefit, or it is, we can say it is simply doing good to the patient. Making benefit is nothing but doing good to the a patient. Okay, so what activities we do, or whatever, say for an example administration of the medication might be there, or doing some procedures, whatever you do on the patient, it should make give some benefit, or it should be in the good of patient. Okay, the example we can take administering the pain medications, then doing some procedures in making benefit of the patient. So these are all being considered as an example for the beneficiency. And the next principles here we can consider is the non-mal efficiency. So this is also very important. Non-mal efficiency means it is do not harm. Okay, you can remember it as a do not harm. Do not harm means we should not harm the patient. Okay, so either knowingly or unknowingly, we never we should not do any harm to the patient. So not doing harm in the sense that is physical harm, emotional harm, or the uh, social harm, any kind of harm should not be done to the patient. So that is all what we call it as a non mal efficiency. Okay, so that is do not do any harm or avoiding the harm or injury to the patients. So say for an example, without giving a test dose, or without identifying the allergies of a medication by with the patient, we directly administer the medication. Okay, where sometimes the patient may go for any adverse reactions or the allergic reaction to the medication. So there it is called as a, means you are making an injury or harm to the patient by without considering the allergic reactions. So there it is called as a mal efficiency. Okay, so we should not do this, means we should not do any harm to the patient. And the next principle is a justice. So justice means it is considering or treating all the patient with the fairly and equally. So without their socioeconomic background, without their education background, or without the sex or whatever it is, we should not consider anything. We should treat all the patients equally and fairly. So that is what we call it as a justice. So justice, treating all patient equally, fairly and equally. So example we can take, so in the ward, when we are working in the ward, so there may be patients, poor patients may be there, or maybe rich patients also be there. So we should consider all the patients are equal. Okay, we should not look for their background or socioeconomic background of the patient when treating a patient. So fairly and equality should be there in providing the care. And the next very important is the fidelity. The fidelity stands for being a faithful, or keeping the promises, or committed to the promise. So whatever the promises we make to the patient, we should be committed. Okay, we should fulfill those promises under any circumstances. So that is what we call it as a fidelity. Okay, or keeping the promises, or keeping the commitment. That is what a fidelity. In simple words, keep the promises or being faithful to the promise. Say for an example, so you told the patient that within 5 minutes I will come back. Okay, the patient has asked something to you, and you told the patient like within 5-10 minutes I will come back, but you never go back, or you will not go back even after 5 to 10 minutes. So that should not be there. Okay, you have made a promise that so you will come back and attend that patient within 5 to 10 minutes. So that promise you have made, and you should be very committed to that promise. So that is what we call it as a fidelity. Okay, so this is a very basic principle, everyone has to follow this. Then veracity, so very important. Veracity stands for telling the truth. Telling the truth. See, telling truth means whatever the information we provide to the patient should be accurate, and it should be true. Okay, we should never give any false information to the patient. Say for an example, when we are say for an example, when we are giving when patient is undergoing the surgery, we consider patient is undergoing surgery, and it has so many complications related to the surgical intervention. See, we should provide information while providing, or when you are taking a consent, we should provide information, we should explain everything related to the consequences of a surgery to the patient. Okay, that is truly we should explain it. So these things will happen during the surgery, you might die during the surgery if it is there. Okay, like that we every true information related to the surgery we should give to the patient. So this is what we call it as a telling the truth. Okay, so instead of saying all these things, this is just a simple surgery, you just give a sign or make a sign on the consent. So this should not be there, means we are hiding the information. So that should not be there. So veracity is nothing but telling the truth to the patient, or whatever the information we provide to the patient should be true or accurate. And hiding the diagnosis also. Okay, say for an example, patient is being diagnosed as a cancer, or okay, but still we will not disclose the diagnosis to the patient. Even a patient is being asked for the patient asked related to his a diagnosis, where we deny or we give an false information that nothing has happened to you, you are perfectly all right. So these kind of false information should not be there. So we should always provide a truth and the true and the accurate information related to the patient care or patient information. So that is what the veracity. So that is a very important principle. And the next principle is accountability. See, accountability is being accountable, or taking a responsibility of one's action. So whatever the nurse does, or whatever the actions taken by the nurse in relation to the patient care, she should be responsible for those actions. Okay, say for an example, if she administer any wrong medication to the patient, she should accept it. She is responsible for this, for that action, or for that activity or the work done by that nurse. So this is what we call it as a keeping an accountability, or being accountable for our own actions or own decisions. So this is a principle of accountability. And the next is a principle of confidentiality. The confidential means it is keeping the patient information safe and the private. Means we should keep the patient related to the patient in the patient's private information privately or secretly. Okay, we can remember this as a keeping the information secret. So without the patient consent, we should never reveal his information to anybody. Okay, that may be means, so we can use his information only when it is necessary, or with those persons, or we can share the information with those persons who are involved in the patient care, and where it makes a necessity of sharing the information. So unless this, without the patient consent, we should never share his information. We should keep it confidential, or we should always maintain a secrecy in his information. Okay, it may be related to, means so the patient may share many things about the personal, or maybe his medical, whatever the information he shares with you, or his any medical record, okay, or his diagnosis, anything. Say for an example, if you take an example like the patient is being diagnosed as an HIV patient, okay, or the HIV, or the patient is already a known case of HIV. So this information we should never share this with anybody else. So we should keep this information safely without the patient consent. It should not be shared with anybody else. So this is we call it as a maintaining the confidentiality. Okay, and there is something closely related to this confidentiality is the privacy. So privacy is also considered as one of the ethical principle. See, privacy means where the patient has a right to control the access to their body parts. Okay, so without the consent we are not supposed to have an access to the patient's body parts, especially the private areas. Okay, unless the patient gives a consent we are not supposed to touch the body parts of the patient. So this is what we call it as a privacy. And whenever we do any procedure on the patient, a minimal body exposure should be there. Okay, unless it is with the necessity. Okay, अगर बॉडी पार्ट एक्सपोज करना ही है तो मिनिमल करना है, या जो पार्ट जो हम एग्जामिनेशन कर रहा है वही पार्ट को एक्सपोज करना है, स्क्रीन को यूज़ करना है या कर्टन्स को यूज़ करना है. ओके, और अननेसेसरली दूसरों को प्रोसीजर के टाइम पे बुलाना, तो ये सब चीज़ें नहीं करना है. ओके, तो ये जो है ब्रीच ऑफ प्राइवेसी हो जाएगा. ओके, मीन्स वी आर breaking the rule of or breaking the principle of privacy. So privacy, if you maintain, if that is to be maintained in providing the patient a care, like बेड बाथ, जब हम बेड बाथ देते हैं, ओके, या बेड मेकिंग करते हैं, ओके, कभी कभी क्या है ना, पेशेंट को ड्रेस चेंजिंग करते टाइम पे या ड्रेसिंग करते टाइम पे या इंजेक्शन देते टाइम पे, IM इंजेक्शंस, तो जैसे ऐसे टाइम पे हम प्राइवेसी मेंटेन करना बहुत ही ज़रूरी है. ओके, सो इट इज़ क्वाइट सिमिलर टू द confidentiality. So if you break this rule then you may have a legal implication if patient go for the legal aspects. Okay, so that is what very important. And the next one is advocacy. So that is advocacy means that is being a lawyer means we should maintain or we should always support the patient's rights. Okay, so we should always respect the patient rights. There were nearly about 21 patients rights are there. Okay, so that right should be always supported and respected when we provide a care. So whenever, and we should always speak with the patient's rights or the patient wishes, as per the patient wish or as per the patient's rights. And the last one is a human dignity. So human dignity means where we have to respect every individual, like addressing the patient with the respect. Okay, not by with the bed number. Okay, and providing privacy. These all the kinds will relates, or it relates to the human dignity or the patient's dignity. Okay, that is what respecting the patient. So these are the ethical principles every nurse, students, and even the practitioner or the teaching faculty, everyone has to follow this during the practice. Okay, so this is very very important. And the next we will discuss is some of the legal issues related to the nursing practice. So what if any mistakes are being done during our practice, so what problems might occur and what are the mistakes we do in the clinical settings or in during our practice. The first thing is that is the breaking the ethical principles. Okay, when you don't follow any ethical principles, that is also an legal issue. Okay, if you don't maintain the confidentiality, if you don't maintain the privacy, if you don't respect the patient's autonomy, if you don't maintain the veracity, fidelity, all this will lead to an legal implications. Okay, that is breaking or breach of ethical principles is also a legal issue. in the nursing practice. So in the when we consider the legal issues, we use some terms like commission. Okay, act of commission. The commission is nothing but doing something wrong. Okay, that should not have been done. जो नहीं करना था गलत काम, वो गलत काम करना, वो जो नहीं करना था वो इसको क्या बोलते हैं हम? कमीशन बोलते हैं. एक्ट ऑफ कमीशन, डूइंग समथिंग रॉन्ग विच शुड नॉट हैव बीन डन. जो नहीं करना चाहिए था लेकिन वो गलत काम कर दिया, इसको क्या बोलते हैं हम? कमीशन बोलते हैं. तो एग्जाम्पल है रॉन्ग मेडिकेशन एडमिनिस्ट्रेशन करना. ओके, गिविंग ए रॉन्ग मेडिकेशन या गलत मेडिकेशन पेशेंट को दे देना, या विदाउट द प्रॉपर ट्रेनिंग पेशेंट को कुछ प्रोसीजर कर देना. ओके, इससे कुछ पेशेंट को गलत हो जाएगा या कुछ हार्म हो जाएगा. या डिसेप्शन, डिसेप्शन का मतलब होता है कि फॉल्स रिकॉर्डिंग करना या फॉल्स इन्फॉर्मेशन देना. तो ये सब क्या है? एक्ट ऑफ कमीशन. ये जो काम है नहीं करना चाहिए, लेकिन फिर भी कई टाइम नर्स ये सब काम, गलत काम करते हैं, तो इसको क्या बोलते हैं हम? एक्ट ऑफ commission. Okay, so this is and one legal issue. If she does any wrong thing, okay, that should not have been done, that act is called as a act of commission. here an example, wrong medication administration करना, या कुछ गलत प्रोसीजर करना, या कुछ गलत इन्फॉर्मेशन दे देना, या रिकॉर्ड्स में एंट्री करना, वो सब ये क्या है? एक्ट ऑफ कमीशन है. और इसके अपोजिट है वो एक्ट ऑफ ओमिशन है. तो ओमिशन जो है, जो काम करना चाहिए था वो नहीं किया. ओके, कमीशन में क्या हो गया? वो गलत काम कर दिया जो नहीं करना चाहिए था. लेकिन ओमिशन में क्या है? जो करना चाहिए. ओके, मीन्स ये जो है काम करना चाहिए, इसका मतलब क्या है? वो जो अच्छा काम है वो करना चाहिए था लेकिन नहीं किया. ओके, फेलिंग टू डू द समथिंग दैट शुड हैव बीन डन. तो जो करना चाहिए था करने में करना नहीं हुआ, तो वो इसको क्या बोलते हैं? वो एक्ट को क्या बोलते हैं? एक्ट ऑफ ओमिशन बोलते हैं. तो फेलिंग टू डू समथिंग शुड नॉट हैव बीन, शुड हैव बीन डन. ओके, तो कभी कभी ये जो ओमिशन क्या होता है? इट मे बी एन अनइंटेंशनल. ओके, कभी कभी हम भूल जाते हैं. से फॉर एन एग्जांपल, मेडिसिन एडमिनिस्ट्रेशन करना था. समझ लो एक पेशेंट को शाम को 6 बजे ये मेडिकेशन देना था, लेकिन नर्स भूल गया, लेकिन वो मेडिकेशन एडमिनिस्ट्रेशन नहीं किया. तो ये जो है विदाउट हर, शी डजंट हैव एन इंटेंशन टू डू दैट, बट स्टिल शी फेल टू डू इट. So there it is called as act of omission. Okay, it may be a negligency. Okay, it is called as a negligence. You can call it as a negligence as well. And सर्जरी के बाद वाइटल साइंस को मॉनिटर करना जरूरी है. ओके, so that is immediately after the post surgery, for every 15 minutes we have to record the vitals. So but here the nurse fails to monitor the vitals. That is also an act of omission. जो करना चाहिए था वो नहीं किया. So this is all what, अगर एक कोई लैब इंफॉर्मेशन, से फॉर एग्जांपल ट्रोपोनिन आई का जो वैल्यूज़ वेरी हायर साइड आया, आपने डॉक्टर को इन्फॉर्म करना चाहिए था लेकिन नहीं किया, तो ये भी क्या है? एक्ट ऑफ ओमिशन है. कमीशन में क्या है? गलत काम कर दिया जो नहीं करना चाहिए था. लेकिन ओमिशन में क्या है? जो करना चाहिए था लेकिन वो कर नहीं पाया या नहीं किया, देन इट इज़ कॉल्ड एज ओमिशन. ओके, तो ये जो थोड़ा अपोजिट वर्ड्स है, यू शुड रिमेंबर इट. ओमिट मीन्स, ओमिट का मतलब होता है, ओमिट मीन्स अवॉइड. ओके, शी हैज़ नॉट डन द वर्क. कमीशन मीन्स शी हैज़ डन द वर्क इन ए रॉन्ग वे. वेरी सिंपल. ओके, चलिए नेक्स्ट देखते हैं एक और वर्ड, टॉर्ट्स. जो टॉर्ट्स ये जो है, दिस इज अ सिविल रॉन्ग committed against a person or a property leading to some legal liabilities. Okay, when we does any harm to the patient or to his property, then it leads to the any patient injury or to the harm, and then it can cause some legal implication. There it is called as tort. अगर हमने कुछ पेशेंट या पेशेंट के प्रॉपर्टीज को कुछ डैमेज किया, then उस एक्ट को हम टॉर्ट्स बोलते हैं। ओके, इसके वजह से हमको लीगल इम्प्लीकेशंस होता है, हो सकता है, या लीगल लायबिलिटीज़ हो सकता है। तो ये जो टॉर्ट्स में वी दीज आर बीन क्लासिफाइड एज एन इंटेंशनल एंड द अनइंटेंशनल। कभी कभी कुछ हम जो काम करते हैं इंटेंशनली होता है, कभी कभी अनइंटेंशनल, मीन्स इंटेंशन नहीं रहता है फिर भी वो गलत काम हो जाता है। कभी कभी हमारे विलिंग से ही हम गलत काम कर देते हैं, तो ये इंटेंशनल है, कभी कभी अनइंटेंशनल भी है। तो अनइंटेंशनल टॉर्ट्स क्या होता है? तो अनइंटेंशनल टॉर्ट्स में एक आता है नेग्लिजेंसी। नेग्लिजेंसी इज वेरी इंपॉर्टेंट, वेयर failure to act as a reasonable nurse would causing harm, means we can consider it as an omission, जहाँ पे काम करने में फेलियर हो जाते हैं, तो देयर इट इज़ कॉल्ड एज ए नेग्लिजेंसी। से फॉर एग्जांपल, एक पेशेंट को वार्ड से एक्सरे डिपार्टमेंट को शिफ्ट कर रहे हैं, शिफ्ट करते टाइम पे नर्स ने भूल गया कि साइड रेल्स रेज करना है, इसके वजह से पेशेंट गिर गया और इसके हड्डी टूट गया। Okay, the patient has forgot to raise the side rails while shifting the patient from an ward to the radiology department, and patient had a fall and had a fractures. So that is a case of a negligency of a nurse. So in this case, the nurse have an legal liabilities. So these kind of acts we call it as a torts. So here the nurse doesn't have an intention to make the patient to fall from the stretcher, but she failed to protect the patient. So this is what the her negligency. Then similarly there is a word called as a malpractice. Malpractice, we can say it is a professional negligency. Professional negligency means where she does the wrong thing to the patient. नेग्लिजेंसी में क्या है, भूल गया लेकिन इधर गलत काम कर दिया, इनके नेग्लिजेंसी वजह से पेशेंट को कुछ गलत हो गया, तो देन इट इज़ कॉल्ड एज माल प्रैक्टिस। एग्जाम्पल, एडमिनिस्ट्रिंग द रॉन्ग मेडिकेशन। डॉक्टर ने एक ड्रग बोला था लेकिन नर्स ने एक और ड्रग दे दिया, गलत ड्रग एडमिनिस्टर कर दिया, देयर इट इज़ कॉल्ड एज माल प्रैक्टिस। ओके, और एडमिनिस्ट्रिंग द रॉन्ग डोसेजेस। डॉक्टर ने कहा था कि 500 mg देना है, नर्स ने एडमिनिस्टर किया 1 ग्राम, so there it is again the malpractice. Okay, so these are the called as a unintentional torts, and opposite आता है intentional torts. Intentional means where we are willingly or do this acts, that is called as intentional. इसमें आता है assault. Assault means where we make a threat a patient physically harm without touching. Okay, पेशेंट को फिजिकली हार्म करता है बिना टच किए, जैसे कि एग्जांपल है थ्रेटनिंग द पेशेंट। ओके, थ्रेटनिंग द पेशेंट टू रिस्ट्रेन, बोल दे कि हम तुमको बांध देंगे। ओके, या फोर्सिबली पेशेंट को टैबलेट दे देना। तो दिस काइंड ऑफ ऑल वर्ड, पेशेंट को बोलना है कि ये गोली खाना ही है। ओके, तो ये these are all what we call it as a type of assault where we harm the patient without touching. And battery, and the second intentional tort is a battery where we do make an physical contact of a patient without the patient consent. Okay, we touch the patient or we handle the patient without making any consent or without taking any consent from the patient. तो एग्जाम्पल है, जब इंजेक्शन देने के टाइम पे हमको बॉडी टच करना पड़ता है, तब पेशेंट को बोलना है कि हम इंजेक्शन दे रहे हैं। ओके, पेशेंट से पहले परमिशन लेना है, अगर वो हाँ बोले तो तभी देना है, अगर बिना वो परमिशन दिए हम अगर उनके बॉडी टच किया तो वो इसको क्या बोलते हैं, बैटरी बोलते हैं। तो दैट इज़ व्हाट द बैटरी। देन फॉल्स इम्प्रिजनमेंट। फॉल्स इम्प्रिजनमेंट वेयर अनलॉफुल रिस्ट्रेंट्स विदाउट द जस्टिफिकेशन, मीन्स पेशेंट को restraints यूज़ करना without the physician order. Okay, there is no any physician order, but still you make a restraining of the patient, you tie the patient's legs, hands, okay, and you make the restraining. So that is all what a type of a false imprisonment. Then the privacy, invasion of privacy, that is violating the patient's right related to the privacy, you keep the patients alone in the in a room, okay, or sharing the patient's details with the somebody else without the patient permission, and do not maintaining the privacy during procedures, okay, that is all kind of a invasion of privacy. Then defamation. The defamation means it is making a false, it's making the false statement that makes a reputation, or that makes a harming the reputation of a patient. ये जो डिफेमेशन आपने कई बार सुना होगा ये नाम, जैसे जब पॉलिटिक्स में ये सब ये पूरा ये नाम अभी सोसाइटी में तो बहुत सारे लोग ये यूज़ करते हैं, डिफेमेशन केस। इसका मतलब ये होता है कि जब कोई पॉलिटिशियन किसी पॉलिटिशियन के ऊपर कुछ गलत बोल देता है या कुछ स्टेटमेंट दे देता है, दैट इज़ गोइंग टू हार्म और मेक एन रेपुटेशन प्रॉब्लम विद देयर रेपुटेशन, उसका नाम खराब हो जाएगा। तो ऐसे कुछ स्टेटमेंट की वजह से या कुछ पत्र की वजह से या रिटर्न स्टेटमेंट की वजह से या स्पोकन स्टेटमेंट वजह से, तो दिस विल मेक एन रेपुटेशन डैमेज, so that kind of thoughts we called as a defamation। तो इसमें अभी अगर हम क्लिनिकल्स में ये यूज़ करते हैं तो अभी जैसे कि पेशेंट को हमने बोल देना कि ये पेशेंट जो है ड्रग एडिक्ट है, okay? तो ड्रग एडिक्ट पेशेंट बिना without proof you label him as a drug addict and you write on the file or on the treatment chart or on the patient chart like a drug addict patient. So these kind of written, this will make and damage to the reputation of the patient, so there it is called as a defamation. If it is a written case, then it is called as label, or if it is a spoken damage, then it is called as a slander. So these are the some legal implications. Okay, so hope you all understood the today's concept of ethical principles. So let me briefly conclude this topic. So we have seen what are ethics. Ethics are nothing but these will help the nurse whether she is doing right or wrong thing in relation to the patient care. Then code of ethics, these are instructions that determines the patient's code of conduct or the professional conduct, कैसे रहना है, क्या उसका बिहेवियर रहना है, एटीट्यूड रहना है, वो सब with this ethical principles, so how she has to work. So that is what the code of ethics. Code of ethics globally given by, that is International Council of Nurses, and for India we have a code of ethics by the INC, and we have discussed the principles of ethical principles, that is basic principles: autonomy, non-maleficency, beneficency, justice, fidelity, then veracity, then advocacy, confidentiality, and the privacy, and the human dignity. So apart from that, we have even discussed the legal issues related to the nursing practice: omission, commission, okay, then torts, intentional and the non-intentional torts. So hope that today's class was very helpful even for the point of examination and for the nursing practice. So as I assured you, we will discuss the MCQs as well. Okay, so in the next video I am going to discuss the MCQs on this ethical principles. Okay, so hope that today's concept is very clear. We'll see you in the next video. So till then, take care, and please do subscribe to my channel, and share it to the friends who are really in need of these classes, because sharing is caring. Okay, means when you are sharing this to your friends, means you are caring your friend as well. Okay, so please do a share, like, and subscribe to my channel, and please support me, and I will try to deliver the content which is up to date and which is very helpful for the upcoming exams. Okay, so till then, take care.